Hi everybody, welcome to Healthline. I am Gregory Zarian. Okay, so the rain is possibly going to stop soon. The weather is warming up. We are tilting a little bit closer to spring. So I hope that means that you let go of the excuses. You get up, you get out. As I say to you all the time, you turn off your phone, you get off the TV, you close your computer, and you just get up and get out and be in the world. You walk through the forest, you put your feet in the sand, you just experience life a little bit more. And that also means bring a friend with you, do it with somebody with family. We spent so much time being stuck on a computer and being inside that I hope you just go. Our mission here is always to give you as much information as we can. So today the topic is all about you women. And it's all about what you need to know about you and your pelvic floor. Joining us from Adventist Health Glendale is Dr. Aldene Zeno and Dr. Prema Kothandaraman. They are urologists, urogynecologists. Is that right?
That's right.
Okay, how did I do on the intro?
Wonderful. Good.
I mean, don't you think we spent so much time inside that, as you and I were talking before, Doctor, that people just, instead of looking at a beach on their computer screen, get up and go out to the beach and be part of that?
Yes.
Before we dive into the topic, real quickly, how important is it for all of us to just get up and get out and be in nature? Now so more than ever, since we've been stuck inside for so long. Dr. Might I call you Dr. Prema?
Yes.
Her patients let her do that.
Yes.
That's okay?
I know, it's a wonderful thing to do, like sit with the nature, not doing anything with electronic, or just merging with the nature and enjoying life. Yeah.
And Dr. Zeno, same thing?
Yeah, it's so important to just feel connected to our surroundings, and not being from LA, there's just so many opportunities to get out, whether it's in the mountains or up in the foothills or out at the beach. So, yeah.
We're already at our quick first break, but off the top of your heads, what's the one thing, both of you, women need to know about their health in regards to the topic urogynecology? The most important thing that comes off the top of your head.
So women has to understand a lot of changes happen in their body and then in their life as part of aging, and also to know the changes and talk to the doctor or the physicians that without embarrassed about their symptoms, and see a gynecologist like every year to know about their body, to learn more about women's health.
And from what age with the gynecologist?
I think after 40, like women needs like a thorough exam once every year regarding their breast exam, pelvic exam, bladder care, and also they are stepping into perimenopause, menopause, hormone changes. So all that can be solved, and that's the right age to begin with.
Yeah, I would agree, and just add that, the American College of OBGYNs recommends as early as 13, girls can come just to start talking about their menstrual history and safe health practices, but also starting at age 21, starting routine screening with yearly cervical cancer screening, talking about vaccinations and things like that, safe sex practices and things starting as early as 21. So that definitely ties into what you were saying about getting out into the world with things opening up after COVID. We're seeing a lot of patients who deferred their yearly visits for their routine women's health checkups during the last 3 years. And so this is a great opportunity to get back into the office and get checked out.
I feel like I'm Charlie and these are my angels. More when we come back. Don't go away. Welcome back. The conversation is all about you women and your pelvic floor and your gynecological health. Joining us from Adventist Health Glendale is Dr. Aldene Zeno and Dr. Prema Kothandaraman. I'm so glad you're here. And one thing that you said in the intro is it's a conversation. We talk a lot about men here, and a lot of men that I've learned from doctors and also people that are in my friends, and I hear of these stories. Men don't talk about their health, but women talk about it more. But you also, both of you said talk about it and being embarrassed. What do you want to say to women that are afraid to talk about what they're going through? Dr. Prema?
So usually the pelvic floor disorders are like the urinary incontinence or sexual dysfunction or pelvic organ prolapse. They are too shy, embarrassed. Even to the primary care doctors, they don't open up until you give them the confidence, you are a good listener. And I usually give a questionnaire before even I go into the room, like to say yes or no to all the above questions. And then slowly you have to get their confidence for them to open up and talk about their pelvic floor dysfunction, mainly the urinary incontinence, like women like leaking small amount of urine during their activities and including their intimacy, that they need to open up and talk about it first. There is a lot of inhibition from the patient to know it is a medical problem. Then once you encourage them, they just talk about their problems, it's easy to make them understand it is a medical issue, then we can work with them.
You said with women, and the first thing you said is like urinary dysfunction and incontinence. Does that affect younger girls, younger women as well? Urinary incontinence? And what is someone looking for in regards to urinary incontinence? And first of all, real quickly, so that's considered a pelvic floor disorder, yes?
Yes.
Okay, great. What are they looking for in regards to signs and symptoms?
Yeah, pelvic floor disorders are a group of symptoms, and that's our specialty as urogynecologists.
Okay.
So when it comes to urinary incontinence, usually that has to do with bladder control issues. So kind of at the severe end of that, women may experience leaking, and that can start in younger women, sometimes when they are involved in high impact activities. It can start...
When you say younger, what are you talking, preteen or even?
No, a little older than that,
Okay.
but more like maybe teenagers or young adults, people in their 20s. We know for like even people like in gymnastics or trampoline sports, certain things like that. We see it probably more commonly in women either during or after pregnancy,
Okay.
especially if they have birth-related trauma. And then another kind of touch point is later in life around menopause, where there's a lot of hormone-related changes that can affect the quality of the tissues that normally support the pelvic organs. So as urogynecologists, we do extra training to help kind of tie all those things together in the treatment of their bladder symptoms.
For younger ladies, is there any urinary dysfunction that young girls should be worried about or look for in regards to, okay, I need to talk to my mom or something's going on?
Yeah, most of the young girls, they have a condition called interstitial cystitis.
Okay.
So it mimics like an overactive bladder.
Okay.
So it's related to their stress level or what their, more carbonated drinks can make interstitial cystitis. So you need to differentiate interstitial cystitis to a real bladder problem. So
Okay.
that in IC, we call it as IC for interstitial cystitis, that needs a lot of reassurance, changes from the patient, including their diet and their stress level, then exercises help. But when it comes to incontinence, like stress urinary incontinence, my youngest patient was 29. So mainly the stress urinary incontinence is related to pregnancy.
Okay.
Pregnancy, the number of pregnancy, the parity, the number of vaginal birth they have, the bigger the babies, the more intervention during delivery. They can be as young as 20s if they have 3 or 4 kids. So there is no age limit. It depends the risk factors, like what's causing the stress urinary incontinence. But as they get older in their 40s and 50s, menopause affects a lot. It makes weakening of the muscles and connective tissue, which is supporting the bladder, supporting the pelvic organs. Then the symptoms are more severe. That's when the patient starts realizing, hey, this is not normal. I'm wearing pads and I need to see a doctor. That's when the urogynecology play a major role.
Yeah, and Dr. Prema mentioned that some women express embarrassment or feel very uncomfortable expressing these symptoms. And some of that does come also from within our own medical community. A lot of other physicians are not aware that there are treatments that exist for these issues. They're typically covered by insurance, so they're medically indicated problems because they cause huge impacts on quality of life for women. So that's where I think our role is really important as urogynecologists to get the word out about the treatments that we offer.
And again, going back to what you said, it's just a conversation. More when we come back, don't go away. Welcome back. I am still Gregory Zarian. Joining us from Adventist Health is Dr. Zeno and Dr. Kothandaraman, and they're urogynecologists. And it's all about you women and ladies today. You talked about younger women and urinary disorders and stuff like that. There are some young ladies out there that are younger and they're practicing sexual experiences and activities. What is your invitation to them in regards to being safe, asking questions, being proactive with their parents, their doctors, and about being as safe as possible? Doctor?
So we usually give them sex education, how the birth control works, and the birth controls don't prevent sexually transmitted disease, and number of urinary tract infections can be related with the sexual practices, getting vaccination for HPV virus, and again, seeing a gynecologist once every year to do testing for pap smear, STDs, and those
How old is somebody?
As soon as sexually active women, even if the younger patients, there is no criteria for a well woman exam.
Okay.
So the criteria is as soon as they are sexually active, they need to be seeing the gynecologist, usually once every year.
Okay. Doctor?
Yeah, I would just add that for really younger patients, for teenagers, often they come with their parents and they might not be as forthcoming when their parents are in the room. So one of the techniques we're often taught is if the patient does end up wanting an exam, or if we want to just allow some space for them to have a deeper conversation about some of those things you mentioned, we'll ask them if they're comfortable having the parent step out of the room. So we kind of trying to find creative ways to do that. And another way I'll kind of introduce the topic with my younger patients is to ask what their friends are doing.
Oh, good.
So some people may, especially younger teenagers, may not be as forthcoming about their own experiences and activities. And we know from studies a lot of times they don't quite have the frontal lobe development to connect
Sure.
their own behaviors with their consequences. So sometimes I'll ask, are your friends sexually active, or what, that kind of thing, and that helps to make it more of a conversation.
And one thing too is that I want to say to anybody that's watching this that's younger or parents, doctors like this are a safe place. And as scary as it may be, parents have the talk with your kids. Kids talk to your parents. My nephews have chatted with me about certain things. And I'm like, okay, have you talked to your parents? One, because I'm not the parent, so I don't want to give any information that's not mine to give. Yet we go through it together. And it's called family, be it friends. And just as much information as you get with your friends, share it with each other, because one mistake can be irreversible.
Yes.
And you want to have as much information as possible. And you're only young once, and we promise you're not going to miss out on anything. Enjoy being young. What are other pelvic floor disorders?
So the most common is urinary incontinence, then fecal incontinence, pelvic organ prolapse. So urinary incontinence can be stress or overactive bladder.
Okay.
Then fecal incontinence, usually around the menopausal age group, again childbirth injuries, aging, previous surgeries, they can make a fecal incontinence. And pelvic organ prolapse is prolapse of the bladder, uterus itself, and the lower rectum. So the women feel like they have something coming out or feel bulges. And one more very important thing I want to say is This whole pelvic floor dysfunction is an underreported problem. Even the patient themselves, they don't know it is a medical problem. They think, oh, it's part of aging, every woman has it, it's going to get better with aging. Same thing with the healthcare professionals. This is one of the problem. Even healthcare professionals are so ignorant about it. And they also say, oh, it is part of aging, it'll get better, there is no treatment. So one of this huge issue, every other woman has it, but this is the problem which has so many myths in society and the patient. So even for a woman to come to see a doctor, like 1 out of 10 women come to see a doctor, there are 9 women who don't even know. We call them as silently suffering, and they cry in the social isolation. They kind of avoid all activities, and it's a huge healthcare issue and an expensive issue, underreported issue, and it's so much education is needed to the patient, to the healthcare professionals. And that's what I love to do it every day.
No, well, because you're also making a difference. Do you want to add something on that, doctor?
No, I think you said that.
It
everything
was
on
pretty
that.
phenomenal. And here's
Yeah.
bottom line is talk about it. And so you can have your general doctor, and then it's just about taking the conversation of, hey, seeing my gynecologist, and then extending the invitation to seeing experts like you two. My sister-in-law, love you very much, was having pain in her lower abdomen and aggressive stage 3 ovarian cancer. And there's some other friends, some friends that I have had that have passed because there's no screening for ovarian cancer. What do you want to say to signs and symptoms in regards to that? What can you contribute in regards to, do people now go see urogynecologists just in case? What is your comments on all of that? Dr. Zeno?
Yeah, I mean, for ovarian cancer, like you alluded to, it's tough. Unfortunately, there is no great screening. We can look at certain risk factors like family history and things like that, but that's not going to capture most people who end up getting diagnosed. So certain things can help, like having your routine yearly GYN checkups. At our office, we perform a pelvic exam at each of those visits and check in with patient symptoms and things like that. And we know that gynecologists are uniquely trained to listen for the common symptoms that we would see in someone with ovarian cancer. So those types of symptoms can include bloating, pain. They tend to be very nonspecific, but with the combination of certain symptoms, that would probably alert us to be more vigilant about maybe doing imaging or something to catch it a little earlier.
And also weight loss and weight gain. True?
Actually, yeah, I want to add here. See, there are no definitive cancer screening, but many studies show a routine pelvic ultrasound every year. Measuring the ovary can predict the ovarian cancer, even though it's not 100%. But in my practice in last 20 years, I have diagnosed 2 ovarian cancers since it was inside the ovary. That's very rare. So I have a practice in my office that after 40, every woman a detailed history, or if they can have a BRCA 1 and 2, if they have a history of breast cancer, and annually, like I do a pelvic ultrasound, measure the ovaries, any concerns, any cyst can be diagnosed before the patient becomes symptomatic. You are waiting for the symptoms, it's stage 2 and 3 or more. So usually weight loss, mass in the abdomen, and like an ascites or other symptoms, and you waited too long. I think there's a significant study, I don't know it's from USC or someplace, but the pelvic ultrasound is accepted standard of care to measure the ovaries once every year.
We're just going to let that sit right there. More when we come back. Don't go away. Adventist Health Glendale is ranked among the best hospitals in America, earning 3 5-star ratings from the Centers for Medicare and Medicaid Services, and it's our 16th straight A grade for patient safety from the Leapfrog Group. Congratulations, Adventist Health Glendale. So joining us from Adventist Health Glendale are my angels, Dr. Zeno and Dr. Prema. Doctor, during the break, we were talking about a procedure that women can receive that is easy in and out in one day. It's called the sling procedure. Can you please share with us?
Yes. I'm one of the physicians for last 20 years, do most number of bladder slings in my practice. This is a very simple outpatient procedure, painless, and like a quick recovery. But the reason I emphasize here, the sling is misunderstood by many patients, including the healthcare providers. Like it's a mesh and creates a lot of issues, and there is a media getting attention about this mesh in the past. But in reality, this mesh what was giving problems, no doctor uses now. The sling material is very friendly and it's absorbable in a patient body, and it helps 100% to the stress urinary incontinence when you evaluate and choose the right patient. And when the diagnosis is correct, the sling works 100%. And also, like I want to, me and Dr. Zeno do a lot of this pelvic floor disorders, like a very systematic approach from history, physical exam, and doing an appropriate in-office test to diagnose. There are many incontinence types. There are many different prolapse of the pelvic organ, and it's closely associated with the menopause. And when you correct the whole thing, we are specially trained extra 3 years to do this pelvic floor dysfunction. So it's better to see when the problem is affects everyday life, quality of life, and to the point they are depressed, they are upset. It's better to see a urogynecologist asking for a referral for a proper evaluation and management.
And one thing too that I want to say is, and I say it on almost every show, don't Google and self-exam.
Yes.
Because most people do that.
Yes.
Yeah.
What is your invitation to women in regards to pelvic floor health?
Yeah, I think letting go of any misconceptions that it has to happen at a certain age, that you have to have babies to have problems, or you don't have problems because you didn't have babies. We see these issues for women at different ages. And we know that it's important to women at all ages because recovering that quality of life helps them be more productive in their jobs. It helps them be more interactive with their families and be more active in their own fitness and wellness.
Well, to get them back in their life.
Exactly.
Yes.
So a lot of the treatments that we offer, like Dr. Prema mentioned, are outpatient procedures or sometimes office-based procedures or no procedures at all, sometimes more medication-based and things like that. So being able to speak with an expert urogynecologist like Dr. Prema or I helps give that patient some options so that they can recover, like you said, their quality of life and get back into being active.
Lifestyle. What is your invitation to women, and what does living a healthy lifestyle look like?
So usually, from young age, the food is part of our main thing, and healthy habits like exercising. And I'm a person who promote a lot of naturopathy, vegan food, and having your body is your doctor. It tells you, and listen to your body, and whether it's sleep, whether it's activity, and choosing your profession, everything has to align. And also for all the incontinence women, I talk to them, hey, open up. We are here to listen to you, evaluate you. And it's every woman comes with so much disappointment because they heard there is no cure for it. I can promise them it is treatable, 100% reversible. And I always tell them, I make you a new woman and a new life.
Any final thoughts, Dr. Zeno?
No, I was just going to say, I mean, that's my other hat. Dr. Prema, mentioned some of the important things with nutrition, and I'm also a certified fitness instructor, and this is, all about quality of life and helping women feel that they have ownership and can make healthy choices.
Okay, I'm such a lucky man being with both of you today. Thank you so much.
Thank you.
Wow.
Thank you.
Thanks for
You're
having
coming
us.
back.
Thank you. Thank you. I teach a lot of my patients spirituality.
Oh, which I love.
Yes. Meditation.
And if you ever decide to treat men,
Yes.
please. Okay, so you heard it, as I said earlier, from my angels, Dr. Zeno and Dr. Prema. First and foremost, have a conversation. don't be afraid to not talk about it. Fear and not doing something is the wrong choice. Talk to your parents. Find out what your family history is. Don't let peer pressure drag you into something you don't want to do. Say no is a complete sentence. And don't be afraid to talk about what's going on. The more conversation you're going to have can possibly save your life. Our mission here is to give you as much information as we can, so thank you for joining us. Remember, the most important conversation you have is about you and your health, and remember to start it right now. You can always find us on social media. You can watch us on YouTube at Adventist Health Glendale, follow us on Facebook at AH, and then you can also find me at Gregory Zarian. Be well, be safe, and we'll see you next time. Thanks.